Okay guys, today we did two cases in conscious sedation. One was for Botox and other was for PRP for face. Now I have my colleague and a very senior pediatric dentist and aesthetic practitioner, Dr. Shipra from Meerut. She'll be explaining you the machine, what are these four chambers and how do we work with it. So I also worked for the first time with it, but both my clients were very happy. We didn't Prilox them up, and we'll be posting the pictures for you guys to understand. And both the clients did not have any issues going into the sedation or coming out of the sedation, and things were very smooth. Yes, as a learner you also have to learn while working with the tubes around that how do you have to change your angulation to inject or any other area while doing PRP, because doing Botox is different. Yes, I consider if I'll do a cases with fillers, I would have to see symmetry, that how do I take the care of the tube at that time, or even in threads, but rest of the places it was fantastic. Now over to Dr. Shipra.
Hi guys, it's a machine. Thank you Dr. Shaurya for inviting me to demonstrate this machine. It is, in the end, it's a nitrous oxide inhalation sedation machine. It is by the Concept company and it's a very easiest way to relax your patient. See, it has a yoke stand in which there are two places in which you can put oxygen, and two are there where nitrous is there. So one oxygen and one nitrous you can use actively, and other two are your backup. So it's very easy to use. You can start by just opening one nitrous and one oxygen in an anti-clockwise manner. Like, I'll show you how you do that. Right, one anti-clockwise, and now I'll be doing with the nitrous anti-clockwise, and then you have to check the pressure in this pressure gauge, right? And this is a flow meter. After that, you need to regulate the flow of oxygen by manipulating this oxygen regulator valve. You have to keep it at 8, and this is a mask, disposable. After that, you just need to make your patient wear this mask like this. They just need to breathe for 3 to 4 minutes. After that, you start titrating it by manipulating this area, right? So it has a reading till 70 and it goes like this. It goes up and this goes down, right? So you just wait, like you have your way to check at whatever level you feel that your patient is appropriately sedated. At that point, you start injecting. Once everything is done, you make this 0 in one go, then again the patient is going to get 100% oxygen and it just goes out. A nitrous effect and everything goes out like this, and there is no residual effect of the gas. Once everything is done, just remove the mask and close everything up.
And the machine which we are using is from Concept.
Concept, right?
Yes. So
thank you so much.
Ma'am works with this machine, and for the first time I also worked with this machine and I enjoyed working with it. So it gave me a different pleasure of injecting client, when it's like, if I say the exact words, my clients were in sort of a trance like after a marijuana. So they were not responding and they were happy. So you would always love. I wish, I can put this thing up onto them when I ask for the payment also, so that they can pay me the whole money in one go. Thank you guys.